GBS, Guillain-Barre syndrome. This is a nerve problem which is managed by a brain doctor neurologist, but the nephrologist kidney doctor also helps in the management of GBS. How? We will get to it right now. GBS is an autoimmune disease. In this, after some infection which may be viral or bacterial in the body develops an autoimmune response and destroys its own peripheral nervous system. This is characterized clinically by a sudden onset of weakness in the lower limbs, which is progressive up to the upper limbs and also to the bulbar muscles. In GBS, the person is brought to the hospital in an emergency and then the doctor evaluates the patient. It is very important to find out the diagnosis clinically and to admit the patient immediately into an ICU in a bigger tertiary hospital setup with ventilator and ICU requirements which may be possible. Need to be evaluated for other causes of quadriparesis, weakness of all the four limbs like snake bite, myasthenia gravis, myopathy, neuropathy, cervical spine problems, etc. If there is an ocular involvement or if there is a bladder bowel involvement, the diagnosis may be something different and needs to be evaluated by the brain doctor neurologist on an urgent basis. Once the patient is admitted, the patient is in the ICU in intensive care and is monitored minute to minute. The temperature, pulse, respiration, respiratory rate, SpO2, oxygen saturation, and the single breath count of the patient is seen. The single breath count is when the person is told to count from 1 to 20, 40 as much as possible without taking another breath. If the single breath count is reducing, deteriorating, then the patient needs more and more intensive monitoring. If the SBC single breath count is improving, then later on the patient may be shifted back to the ward and later on discharged. GBS is a clinical diagnosis, but supportive investigations may be done later on after admission. This includes nerve conduction velocity study which shows axonopathy, and there may be a lumbar puncture of the cerebrospinal fluid, and this shows a albuminocytological dissociation. The management of this is directed by the neurologist brain doctor, and if a plasmapheresis is advised, then the treatment is taken over by the nephrologist under the management of the neurologist who directs how much plasmapheresis to give to the patient. Whenever the plasmapheresis is given, it is given daily or alternative up to 10 days. Plasmapheresis helps to remove the toxins which are damaging the peripheral nerves and in faster recovery of the patient. Steroids, which are usually given in kidney patients for helping save the kidney, is not useful in Guillain-Barre syndrome and is not recommended. Ig Immuno-Globulin may be given to the patient daily for up to 5 days. The other thing is the ventilator requirement. If the single breath count is less than 20 with poor neck holding, or if there is a very fast breathing or a very slow breathing, or if the carbon dioxide in the arterial blood gas analysis is very high, then elective intubation and ventilation of the patient is recommended, and that helps in saving the life of the patient. The other management of the patient includes general nursing care, high level of nutrition, and antibiotics, bedsore prevention, bedsore care. After all this, the mainstay of treatment becomes a physiotherapy. The physiotherapy helps to regain the strength of the muscles and to regain the normal life of the person. There is no preventive care for GBS. It is the prevention of infections per se. So hand washing, using a face mask, good hygienic food, boiled water, and remaining away from sources of infection like other people having cough, cold, skin rash, etc. is very helpful in preventing the spread of infections in the general population and reducing the incidence of GBS in the population. So finally, GBS is a nerve problem, autoimmune nerve problem, which is managed by the brain doctor neurologist, but whenever the management includes plasmapheresis, that is taken over on a dialysis machine by the kidney doctor nephrologist. Thank you.